My name is Elizabeth Marinaro, and I'm a neurosurgery physician assistant. So when I was 5 years old, my dad was driving us up to New York, and we drove past Johns Hopkins, and I thought it was a castle. My dad tried to correct me and tell me that it was a hospital, and I just didn't believe him until later on. And I actually got to practice there for the first 5 years of my career. I was there through the pandemic, and I was trained in cranial and spine. I also participated in a lot of Chiari malformation research, which was one of the highlights of my career there. When I was in college, I completely fell in love with neuroscience. Now I'm super excited to be back in my hometown and practicing medicine here. The thing I like most about my patients is, to me, it's not just the medical part, right? Like, it's also getting to know them. You become close with them, with their families, and you learn from them as well. I truly remember the most random facts about patients, like their dog's name, their kids, their grandkids. They'll show me pictures, and I always like to get to know them on a personal level. You know, we spend a lot of time in the OR trying to make outcomes that seem impossible happen. And so when you do get those good outcomes, it makes it all worth it. I value the trust that patients have to give us, because when they come to us, they're a lot of times in their most vulnerable state. And we don't take that lightly. That's something that we really want to make sure that they feel cared for and that they are in the best hands possible.